after cataract surgery. And as you know, PCO is caused by the migrations of epithelial cells, window cells, and the window cells without basal membrane will produce alternate pores, and the window cells with basal membrane will produce cell-adhering ring. It is the picture of cell-adhering ring, and it's the picture of alternate pores. When the epithelial cells migrate across the capsular, it can cause capsular winkling and capsular opacification. And there are some influence factors which are patient's age, the condition of intraocular inflammation, the existence of pseudo-exposed deviation syndrome, the size of the anterior capsular resist, the quality of the cortical cleanup, the capsular fixation of the implant, the design of the lens, the modification of the lens surface, the time since surgery, the anti-inflammatory medication, and the existence of silicone oil. And one of the most important management of PCO is using your laser for capsulotomy. And some indication of using laser are the first one is PCO affect visual acuity. The second one is PCO prevent the clear view of the ocular fundus. The third one is PCO cause molecular diplopia, a mild rod-like effect or gray. The fourth one is capsular phimosis, and final one is capsular block syndrome. And there are some contraindications of using young laser. The first one is unclear vision of posterior capsule. The second one is patients who are not cooperative, and some related contraindication includes intraocular inflammation, uncontrolled glaucoma, high risk of retinal detachment, and subtoxemia. I want to introduce a research about the anti-inflammatory medication after cataract surgery and posterior capsular opacification. It is a research in 2020. The purpose of the research is to assess the role of anti-inflammatory medication following cataract surgery on the formation of posterior capsular opacification. And over 25,000 patients undergo cataract surgery between the years 2014 and 2018 at Helsinki University Hospital in Finland. And the laser capsulotomy rate will be compared among three groups. The first one is the group of patients use topical steroids. The second one, patient use NSAID, and the third one, patient use their combination. And the result can be presented through some paragraphs. The first paragraph shows us that at the time of the percentage of patients survival without clinically significant PCO, and you can see at the time of 24 months, there is no difference between the two groups, the group using steroid and the group using NSAID. But there are differences at the time of 36 and 48 months. The second paragraph shows the patient, the percentage patient survival without clinical significant PCO after the patient age, sex, existence of pseudo-exfoliation and risk stratification, and you can see that there are differences between two groups over over months. And the third paragraph shows us the difference between two groups, the group using steroid and the group using the combination. And you can see there is no difference between two groups. And the research also shows some factors that can affect the PCO rate, which are patient's age and patient sex. The patient who are under 65 years old will have a lower rate in comparison with the patient over 65 years old. And female patients also have a higher rate. And there are some factors in this research. It not influence the PCO rate, which are surgical risk stratification, the expansion, the using of expansion device, the existence of DME or PRD, and the existence of zero exfoliation, and finally is the type of post-operative topical steroid. To conclude, in this research, using steroid was associated with lower PCO rates compared to treatment with NSAID, and the combination therapy of steroid and NSAID had no added benefit over steroid treatment alone. My presentation is finished. Thank you for listening.
Thank you, Dr. Dung, for your presentation. So we see a study with quite a large number of the patients, nearly 20,000 patients, surgery, right? It's quite large in one hospital. And you can see the rate of the PCO and the relationship of using corticosteroid and NSAID with the PCO. So is there any question or comment from you, from audience? I don't know. Anyone to say something? And the residents, doctor, support your colleagues? Just one question I'd like to ask more. You can see here the comparison between the rate of PCO of the patient who uses steroid and who use NSAID. Can you tell us about the reason how long they use the corticosteroid and NSAID after the surgery, and what is the dose between two groups?
Dose.
Yes.
Actually, in this research, the steroid, the type of steroid used is dexamethasone, and they use three times per day.
And for how long?
From 1 to 3 months.
1 to 3 months.
After surgery.
For 3 months.
Yes.
Continuously.
Yes.
What about the NSAID?
Is the same. Is the same. They also use diclofenac.
Yeah.
Yeah, and from 1 to 3 months after surgery.
So you mean from 1 to 3 months? It means that some patients use only 1 month and some 2 months and some 3 months, right?
Yes.
Yeah.
They said that they will adjust the time, the period of using drugs based on the intraocular inflammation condition of patients and some
Complication.
And some complication after surgery, for example, CME.
Yeah. It is quite different because normally after a few weeks, 1 or 3 weeks, 4 weeks, the inflammation has gone after cataract surgery. But here they continue to use corticosteroid or NSAID after that, right? That's one thing. And here from this graph, you can see that the rate of the PCO of the steroid group is lower than NSAID group, right?
Yes.
Yeah. So what about the rate of complications such as hyperocular tension? The rate of glaucoma due to corticosteroid, is it different between two groups or not? They have any information about that?
They didn't mention on the research, so I actually I don't know about the about for example glaucoma because of using steroid. After that, they didn't mention.
Yeah.
Yeah.
So this study is a retrospective study, right?
It's cohort study.
Cohort study.
Yes.
So, please, any question or comment about this issue? They continue to use corticosteroid 3 months after the surgery. One group, and the second group, NSAID only, and the third group, combination between corticosteroid and NSAIDs. It's quite long, it's quite funny. And it's a cohort study. It's funny. Yeah. Okay. So, any question? So if we have no questions, thank you very much, Dr. Dung, for your presentation. And thank you for very good indeed.
Thank you so much.
Yeah. Thank you, Professor Hiệp, and thank you everybody, and see you next week.